Hello, and welcome to Enhancing Asthma Control in New Mexico, Addressing Youth Cessation. Cultural competence is absolutely crucial to the advancement of health equity and in delivering effective substance use disorder treatment, including treatment for tobacco use and dependence. All references in this presentation to tobacco and tobacco products are referring to commercial tobacco and nicotine-containing products and not the sacred use of the tobacco plant by some American Indian and Indigenous communities. Quick disclosure here, policies and standards of the Greater Albuquerque Medical Association, or GAMA, the New Mexico Medical Society, the Accreditation Council for Continuing Medical Education, and the American Medical Association require that speakers and planners for continuing medical education activities disclose any relevant financial relationships they may have with commercial interests whose products, devices, or services may be discussed in the content of a CME activity. Regarding this activity, Enhancing Asthma Control in New Mexico, Addressing Youth Cessation, the following speakers, planners, and presenters have disclosures. You can see those on your screen right now. All conflicts of interest have been resolved in accordance with GAMA, NMMS, ACCME, and AMA policies and procedures. We would also like to acknowledge that this activity was planned and supervised by Constellation Consulting, and it is supported in part by a grant from the New Mexico Department of Health Nicotine Use Prevention and Control Program. Our agenda today is as follows. We're going to have a level setting around the prevalence of commercial tobacco use in adolescents, looking at both New Mexico and the United States. We're going to talk a little bit about Exhale for asthma control, and that's the CDC's technical package for quality improvement and asthma control. And then we will really be focusing and diving deep into addressing nicotine and tobacco dependency in adolescents. So again, hello and welcome to Enhancing Asthma Control in New Mexico, Addressing Youth Cessation. My name is Rebecca Padilla. Pronouns are she, her. I'm a national manager for tobacco programs at the American Lung Association, and I'm excited to chat more with you today about this very important topic. First things first, we are going to chat about the prevalence of commercial tobacco product use in adolescents. When we talk about tobacco use in general, the chart on your screen right now is something that many of us that are watching commercial tobacco product trends are really familiar with. And that's the fact that there's been a steady decline of cigarette use. But this data is specifically for cigarettes and for the average adult population. Still today, though, tobacco use is responsible for 480,000 people dying every year. The US Surgeon General recently announced that e-cigarette use amongst youth was an epidemic. And e-cigarettes have really been the most commonly used commercial tobacco product among young people since 2014. After increasing in prevalence between 2017 and 2019, current or past 30-day use of e-cigarettes went down slightly among middle and high school students from 2019 to 2020. So what this means is about 1 of every 20 middle school students reported in 2020 that they used e-cigarettes in the past 30 days, and about 1 of every 5 high school students reported that they also used e-cigarettes in the last 30 days. In 2020, we can see that 16.1% of adults in New Mexico smoked cigarettes. Nationally, the rate was 15.5%. In 2019, 8.9% of high school students in New Mexico smoked cigarettes on at least one day in that 30-day reporting period. And nationally, the rate was about 6%. So we can see amongst both youth and adults in New Mexico, the tobacco use rate is slightly higher than the national average. Additionally, many young people use 2 or more tobacco products. In 2020, nearly 3 out of every 100 middle school students and about 8 out of every 100 high school students reported current use of 2 or more tobacco products in the last 30 days. So it's important before we move on through this topic to look a little bit at the prevalence rate of asthma in New Mexico. Asthma is one of the most common chronic diseases here in New Mexico, with an estimated 26,000 children currently being diagnosed with the chronic disease. People with asthma are more likely to miss school or work, report feelings of depression, and experience an overall reduced quality of life. Asthma-related hospitalizations are about 3 times higher among children than adults. So the chart on the screen right now represents that data on hospitalization rates from 2016 to 2020. So when we look at New Mexico asthma-related hospitalizations by age and gender, we can see that boys aged 0 to 9-year-old have the highest asthma-related hospitalization rates. These rates decline as males get older. Rates among females also decline as they reach their teens, but then again begin to increase in their 30s and 40s. Overall, females experience a higher asthma-related hospitalization rate than males. We also see seasonal trends in hospitalization rates amongst people with asthma here in New Mexico. These rates are highest in February and March and tend to be lowest in the summer months, June and July. These seasonal trends follow the school year calendar. Research suggests that the transmission of routine infectious diseases like influenza and the common cold in the school environment can severely impact a child's ability to control their asthma, which sometimes leads to hospitalization. Some of you may be working in addressing asthma. CCARE, Controlling Childhood Asthma and Reducing Emergency, is the CDC's objective of preventing 500,000 emergency department visits and hospitalizations due to asthma by August 31st, 2024. The CDC is working with their partners across the nation to increase coordination and to encourage those partners who provide evidence-based interventions as outlined in CDC's Exhale package, which we'll talk about in just a moment, to expand their work to reach more children with asthma. The CDC and its partners are working together to increase awareness of CCARE and Exhale among target audiences. Specifically, those audiences are organizations with access to high burden populations, people with asthma and their families and caregivers, asthma care providers, and other key decision makers. Another objective of this is to establish new or foster existing relationships with strategic community partners, and finally, to increase equitable implementation of interventions among those target audiences. So let's review the Exhale technical package for just a moment. The CDC Exhale strategies have been proven to reduce asthma-related hospitalizations emergency department visits, and healthcare costs. Using the Exhale strategies together in a community can have a really great impact. As you can see here, Exhale is an acronym for education, extinguishing, home visits, achievement, linkages, and environmental policies. So we don't have time to dig into each one of these key strategies. They're listed on your screen, and we'll have a companion resource available with this training so you can review these strategies a little more in depth if you're interested. However, it's the X in Exhale that we're really going to focus in on today. So the X in Exhale stands for extinguishing smoking and secondhand smoke exposure. And we do this through reducing tobacco smoking and use of e-cigarettes and reducing exposure to secondhand smoke and secondhand aerosol. So again, as I mentioned, we have an additional resource that accompanies today's training that includes all of our training slides and additional information that we're talking about today, including that Exhale resource page. So now that we've done a very brief review of prevalence rates amongst youth with both tobacco use and with asthma, let's talk about those overlaps of smoking, e-cigarettes, and asthma. E-cigarettes were really first marketed in the United States as a harm reduction product. However, they've not been found to be safe or effective as a cessation aid. And actually, we see that people who use e-cigarettes are more likely to be dual use consumers, meaning that they will consume both e-cigarettes and other tobacco products like combustible or smokeless tobacco. We're really concerned about the targeted marketing that has been done to our youth and the misinformation campaign that has been really effective in conveying the idea that e-cigarettes are somehow different than other commercial tobacco products. We know that vaping affects the body in numerous ways. First of all, nicotine may cause inflammation of the lungs, which can worsen asthma symptoms. In fact, studies have shown that short-term effects caused by smoking and e-cigarette use are very similar. Coughing, dizziness, headaches, the list goes on. While we continue to monitor research outcomes pertaining to the lasting and long-term health consequences of vaping, we're very troubled by the evolving evidence about the impact of e-cigarettes on the lungs in particular. These products produce a number of dangerous chemicals, including aldehydes, which we know can cause lung disease, as well as cardiovascular or heart disease. They also contain other chemicals like acrolein, and these chemicals have been known to cause acute lung injury, as well as chronic obstructive pulmonary disease, and may worsen or even cause chronic diseases such as asthma and lung cancer. When it comes to vaping and asthma in particular, more studies are beginning to show that vaping can increase inflammation in the airways and can cause breathing difficulties, which can intensify asthma symptoms and trigger asthma exacerbations or asthma attacks. According to research, e-cigarette users were about 30% more likely to develop chronic lung disease, and this is really concerning. It's important to understand how vaping triggers asthma symptoms. The main chemicals in e-cigarettes, such as propylene glycol and vegetable glycerins, have been linked to increased cough and mucus production, chest tightness, and reduced lung function, all of which can really make asthma worse. Vaping can irritate the lungs' airways, making asthma exacerbations more likely. And recent comprehensive studies have shown that e-cigarette users have more common side effects, including coughing and dry throat, which could in turn make asthma worse. Secondhand aerosol from these products as well can have harmful effects for people with asthma. A study published in 2019, for example, found that teenagers with asthma who were exposed to secondhand e-cigarette aerosol were 27% more likely to report having had an asthma attack in the previous year compared to those who were not exposed to that secondhand aerosol. So let's think about what can be done to address this higher rate of use amongst people, especially young people with asthma. I'm really excited today to introduce you all to Dr. Paige Pomo, who is joining us to advise on this exact topic. Dr. Paige Pomo is a primary care pediatrician in Farmington, New Mexico, and is a graduate of the UNM School of Medicine. She currently serves as the New Mexico Pediatric Society's chair for Early Career Physicians Committee and is the American Academy of Pediatrics e-cigarette chapter champion for New Mexico. Since taking on her position as the AAP's e-cigarette chapter champion in 2020, Dr. Pomo has participated in tobacco-related advocacy opportunities and has served as an expert witness on the harms of e-cigarette and commercial tobacco use in youth for both a House and Senate bill here in New Mexico related to raising tobacco product taxes during the 2021 legislative session. Additionally, Dr. Pomo has collaborated with local school districts to provide education to students and teachers on the harms of vaping, and has provided cessation resources. Dr. Pomo hopes to continue sharing her knowledge regarding e-cigarette prevention and cessation in youth and empower other pediatricians to educate and advocate for their own patients on this very important topic. So without further ado, I'd like to turn things over to Dr. Paige Pomo. Dr. Pomo?
Thank you, Rebecca. I appreciate the opportunity. So as Rebecca alluded to, the AAP has a new cessation resource for providers. All of the resources we discuss here today will be available through the AAP website, aap.org/cessation. So it's important to note that this is really supposed to be a practical tool for clinicians to support youth who are using tobacco. It's product agnostic in the sense that it's really promoting cessation for all tobacco products and nicotine products. So not just combustible cigarettes or e-cigarettes, but also chewing tobacco products. It's cessation focused, not prevention focused, but the AAP has a plethora of resources that are also prevention focused that we won't cover in this discussion here, but just know that those do exist. So I'm hoping over the next couple minutes and slides, I can help kind of synthesize and highlight some of the key pieces of the cessation toolkit that are available to you through the AAP. So they're using a model called the ACT, or Ask, Counsel, and Treat. And there's a clinical flow chart that I'll be going through with you during the course of this discussion. I want to highlight a few other pieces that will be brought up throughout the discussion as well. One being a fact sheet on how to utilize your electronic health record in regards to youth tobacco cessation to try and streamline your own systems that are already in your clinics and in your EHRs to really make youth tobacco cessation counseling easy and streamlined. So the AAP has a great fact sheet available on the website as well. We'll also be covering a couple pieces regarding behavioral supports, as well as nicotine replacement therapy, or NRT, for clinicians. So this is an example of what the algorithm looks like for the ACT model. So the point is it's supposed to only take a couple minutes out of your time. And the goal is that you're screening and counseling youth who are using tobacco at each encounter, not just well checks, but at any sort of acute visit or follow-up visit. And they've tried to make it as simple as possible. So the A stands for ask. We're trying to screen tobacco use in all youth during every clinical encounter. You're going to counsel youth. You're going to advise youth who are using tobacco to quit and help them set a quit date. And then for those that are using and that may need additional behavioral supports and or pharmacologic supports, there's additional resources to guide you through that process and how to follow up with these patients. So I'm going to highlight each of these elements in the subsequent slides. So first, ask. We're encouraging through the AAP that all clinicians are screening for tobacco use for youth ages 11 and older at every encounter. And the AAP does a great job of providing some language for us in terms of how to open up that discussion, which we'll see highlighted in the blue text on the following slides in quotations. Some of the key pieces to remember is that we have to use the language that our patients are using in terms of smoking and vaping. So if we're screening and saying, do you smoke? A lot of youth aren't going to answer yes to that question. But if you say, are you vaping or dipping or using a Juul or puff bar and using those specific languages, with youth, you're more likely to get a positive answer if they actually are using. Additionally, it's important to incorporate questions into your existing screeners. So trying to make it streamlined with your electronic health record is really important. And when possible, try to screen confidentially without a parent or guardian present so that you're more likely to get an accurate or truthful answer. So there's a couple resources that I'll highlight in terms of screeners that you can use within your clinic. And the important piece to remember is that for youth that are not using, that maybe truly are not vaping or smoking, reinforce that positive behavior and then screen again at the next time because things can change between visits. So I want to highlight a couple of the pieces that are in the cessation package that may be useful to you as you're taking that first step of the algorithm, the ask. On the left side, you'll see there are several different kind of infographics that describe different electronic tobacco products, combustible tobacco products, and non-combustible tobacco products, which can be helpful when you're screening youth or just educating different clinical support staff who may be screening youth in terms of the type of language and devices that they should be using when asking these questions. On the right hand of the screen, you can see some other screening questions that can either be patient administered or clinician administered, which include the screening to brief intervention, and then the craft that also incorporates other substance use screening questions as well. So we've asked the youth, we've identified that they're using tobacco. The next step is to counsel them. So we want to counsel all patients who use tobacco about quitting, regardless of the amount that they're using. And so it's first of all, it's important to be clear, right? We want to let these youth know that nicotine in any form is not safe and it can harm their brain development. We know that youth are uniquely susceptible to nicotine. And in particular, it's important as practitioners to know that youth in particular can show signs of dependence much more quickly than adults, even if they're not using on a daily or regular basis. So we want to really get them to quit because we know that's key to preventing short and long-term complications from a health standpoint. The next piece to remember is we want to be personalized about our message and counseling. We want to try and highlight some of the pieces that we know the youth might care about and might be a motivation for them to quit. Maybe they're an athlete and they want to run better. Maybe they're in marching band and they need to be able to play their instrument effectively. Or maybe they just have long-term goals like going to college or wanting to study or work in a particular profession that's going to require them to be healthy. And so trying to frame your conversation around quitting in a way that you can hook that youth in to motivate them to quit. And so motivational interviewing, which is a technique we don't have time to delve into, but that can also be a really helpful modality when you're talking with patients about setting a quit plan and really quitting their tobacco use. And the AAP also has great resources on how to incorporate motivational interviewing into your screening questions and your counseling with patients. The last piece to remember is it's really important to ask why. Why is the youth using tobacco? Oftentimes they may be actually using it to self-treat or cope with stress, anxiety, depression. And so that can be a really useful and just helpful piece for you as the clinician to know that Maybe they actually have underlying depression or anxiety, and that's what's a driver for them using these nicotine products, so that you can hopefully help them create healthier coping strategies, in addition to maybe plugging them into additional behavioral health resources, in addition to the tobacco-based resources you're going to provide them. Additionally, some youth may be using on a longer term basis and may have tried to quit previously. So it's important to ask about maybe prior history of tobacco use or quit attempts, because that may help frame how you're going to structure their current quit plan and help kind of identify challenges. So the youth is ready to quit. Ideally, you want to help them set a quit date within 2 weeks. You want to connect that youth with behavioral support programs and set a follow-up date to see how that quit attempt went. Some tips for success to remember is that you want to encourage the youth, if possible, to kind of have a support group around them. So ideally, that would be their parents. That's not always possible, depending upon sort of what the context is, if this is confidential or not confidential, that their parent knows or doesn't know. But it could be a friend, a teacher, a coach, someone else to maybe be part of that quit team to support them. For youth who may be uncertain about quitting, you can consider the 5 R's in terms of helping kind of them think about why a quit attempt might be important. And so those are highlighted below. Relevance of quitting may be something you discuss with them, the risks of not quitting, the rewards related to deciding to quit, some roadblocks or challenges that may arise, and then the repetition piece, recognizing and acknowledging that it may take several attempts to succeed in quitting. For those youth that really aren't ready to quit, the AAP recommends a strategy for youth called kind of the 2-week challenge. So if a patient isn't ready to quit and tells you, oh, I can quit at any time, that's actually a pretty common thing that I hear in my clinic with my teens that are using tobacco and e-cigarette products. So the point is, you as the clinician can actually challenge them. Okay, great. So you think you can quit anytime? Do you think you can try and quit over the next 2 weeks and just see how you do? Maybe the youth isn't willing to do that, so you could even challenge them to quit for a period of 1 to 3 days, and then ask if you can check in at the end of that period to see how it went. Because that might be insightful for the youth to realize, maybe I can't quit at any time. Maybe this was harder than I thought it would be. And that might also open up a door for you to, again, provide additional cessation support at that follow-up. So the last piece of this cessation package is treat. So we want to link youth with appropriate behavioral supports and even consider prescribing cessation resources or medication when indicated. So the point is that all youth need to be plugged in with cessation/behavioral cessation support. So what does that look like? The AAP has created a great list of resources on their website, which is highlighted in this slide. Anything from text-based services to web-based services, phone calls, and in-person coaching support is available. And so I encourage you to take a look at these resources and find maybe local resources as well as national ones that you can utilize in your clinic. Additionally, it's important to think about the elements of a successful quit plan. So you want to quit the substance completely, right? You don't want the youth having easy access to any of these tobacco or vaping products, because if they're in the house, it's more likely that they're going to use it. Or if they're in a situation like with the same friends that use, or places where they typically use, that's going to be a lot more challenging for them to have a successful quit plan. So think about those kind of challenges or triggers that may contribute to either the success or maybe detriment of their quit plan. It's important to counsel teenagers about what withdrawal symptoms look like, because they may not know what that looks like for them. So kind of go over what those look like, the cravings, the irritability, their change or increase in appetite, and think about some strategies with them on how to mitigate those. Additionally, like I highlighted before, we want some social support when they're trying to quit. You want to try and get family or friend engaged with them to help encourage this quit attempt. And then additionally, it's important to think about self-care. These teens are oftentimes using to the degree that it's consuming quite a bit of their time. And so this void is left in terms of where they used to use the tobacco product or vape device. And so now they don't know what to do with this free time. So encouraging them to think about ways to be active, to take on another hobby, so that they kind of have that healthy distraction as they're going through this quit attempt to help them hopefully be more successful and really just build healthier lifestyle strategies and techniques moving forward. So for youth that are using on a more moderate to severe range or have a moderate to severe level of dependence, the AAP recommends first screening a youth to figure out what their dependence level is, and then strongly considering as a clinician utilizing nicotine replacement therapy or NRT to help support these youth in addition to just the behavioral cessation resources we highlighted previously. So there's several modalities for nicotine replacement therapy, ranging from patches, gums, lozenges, to medications like buprenorphine, for example. And it's important to remember that all of these NRT modalities are going to require a prescription for youth that are under the age of 18. So they won't be able to buy them over the counter. And the AAP has done a phenomenal job putting together a resource guide and just kind of step-by-step guide on how to use these medications, dosing, step down, etc. So I really encourage you to take a look at these because they've really made it quite simple in terms of finding all of those resources in a one kind of one place. So please, I encourage you to take a look at those. They've been very helpful for me in my own practice. So in terms of what resources you can use to screen a youth to figure out if they're kind of in that moderate to severe dependence range, a couple different screeners, including the Hooked on Nicotine, the e-cigarette dependence scale, and the modified Fagerstrom are just a couple. And those screening tools are actually available in the NRT handout that is available on the AAP Cessation resource. So again, important to remember that you want to pair these with a behavioral cessation support. And then also remembering that the youth is going to need both a long and short-term NRT modality. So for example, you want to pair a nicotine patch with a lozenge or a gum, depending upon the youth's preference. And that they actually, on the NRT handout, actually walk you through kind of the progression in terms of step-down therapy, so that you and the youth can kind of know what your plan is going to be as they're utilizing this and when your check-in points are going to be. It's also important just for youth that are still in school that they may actually need a school note from you or a form filled out so that the school nurse, for example, is aware that they're using these products under the advice of a provider so that they don't get penalized or in trouble for utilizing these in a school setting. So keep that in mind. So in terms of resources that are available for providers in New Mexico, we have several that are actually specific to our state. So as Rebecca mentioned, I'm part of the New Mexico Pediatric Society, which is like our American Academy of Pediatric state level chapter. And we've created an e-cigarettes and just tobacco use prevention and cessation webpage within our bigger webpage. So the link is here, and there's lots of resources both for providers, parents, schools, and youth at a national level and at a state level. So hopefully that will be a helpful resource for you as well. And then the Vape documentary is by Chris Schuler. He's a cinematographer in New Mexico and created this back in 2019 to as sort of a documentary that was youth driven. So it's sort of by youth and for youth in terms of prevention and cessation surrounding the vaping epidemic. So we have a couple of their clips actually on our website as well, and his direct web link is available as well if you wanted to see the entire documentary. I encourage you. It's a great view. Additionally, in New Mexico, we have the quitnownm.com, which is a website, and then there's also a phone-based service that's 24/7 support both for tobacco and vaping products. They can have trained quit coaches, self-help materials, access to NRT supplies. Again, that's only applies to patients that are 18 and older. If they're under that age, they will need a prescription from their provider. But they really they're able to tailor the services they provide for youth as well as pregnant people as well. So a great resource to consider. And we really just hope that you as your provider and your care team will be able to utilize these resources from the AAP and from the New Mexico-based resources And we hope you find them truly just helpful and consider using them with your own patients in your practice. So thank you so much for your time.
In addition to the great resources that Dr. Pomo just highlighted, I would also like to invite you to take a look at American Lung Association's Not For Me web-based cessation program. On your screen is a QR code that will take you to a demo of this evidence-based, no-cost, on-demand, web-based cessation program specifically designed for young people. Additionally, I'd like to invite you to check out some more trainings that are available through the American Lung Association. These are all on-demand online courses for healthcare professionals, school personnel, and community members. And again, these are all available on lung.training. You can also scan the QR code on your screen to be redirected to that site. The CDC has tons of resources available for folks just like you and for the people you serve in the community. They offer resources for providers, including information on FDA-approved quit medications, tailored information for specific population groups that you might be serving in the community, including youth, pregnant people, and the behavioral health community. And they have tons of support tools for helping people quit, including the Quit Start app, social support, text to quit, tailored quit plans, and more. You can check all of this out on cdc.gov/quit. Again, Dr. Pomo mentioned the state quit line just a few minutes ago, but I want to give one last reminder that the Nicotine Use Prevention and Control Program of New Mexico, also known as NUPAC, and its partners use comprehensive evidence-based approaches to promote healthy lifestyles that are free from commercial tobacco use and addiction among all New Mexicans. NUPAC follows recommendations from the CDC and works with communities, schools, and organizations across our state to implement activities and services that help to decrease the harmful and addictive use of commercial tobacco products. This in turn helps to reduce tobacco-related illnesses, it saves lives, and it saves money. Activities that encompass this comprehensive approach include community-based programs, school tobacco policies, cessation services, public awareness and education campaigns, and initiatives to reduce health disparities. I highly recommend that you reach out to NUPAC NM. We will have the links available in that companion resource for today's training. There's lots of great folks on the team that are ready to help support you with health systems change initiatives, with integrating the quit line, or answering your questions on how you can further support and address cessation amongst youth here in New Mexico. So with that, if you have additional questions or would like more information on how you can support health equity in New Mexico, or if you have questions about today's training, you can reach out to Constellation Consulting in New Mexico. The website and phone number are on your screen. To request CEUs for this session, we invite you to scan the QR code or visit the website on the screen. So with that, we would like to thank you for your time today, and thank you for supporting the youth of New Mexico through enhanced asthma care and cessation. And with that, we would like to thank you for your time today.